This video will demonstrate proper technique for use of your clinical bag. Employees are to follow infection control, best practice techniques when supplies and equipment are brought into the home. When transporting your bag in your vehicle, ensure it is on a clean surface or use a barrier. Upon arrival in the home, place your bag without wheels on a clean, hard, dry surface with a waterproof barrier beneath it. Avoid upholstered furniture and visibly soiled areas. Never place it on the floor, not even on a barrier. If your bag needs to be placed on an upholstered surface, use a waterproof barrier. A bag with wheels should always stay on the floor. Before reaching in your bag, perform appropriate hand hygiene per the hand hygiene policy. Best practice is to keep your bag zipped closed when not in use. The bag should be divided into different compartments: reusable items and single-use items. Do not mix personal items, such as a cell phone or keys, with patient care items. Store in a separate pocket. All needed supplies and equipment should be placed on a barrier, including your electronic device. Perform hand hygiene. To clean vital sign equipment, sanitize hands and apply gloves. Wipe equipment with approved product and allow to dry on a clean barrier for the required amount of time prior to placing back in your bag. Gloves should be worn to protect the skin from the disinfectant. If you remove any type of pouch from your bag, it must be cleaned prior to putting back in the bag. Remove gloves and sanitize your hands. After sanitizing hands, place air-dried vital sign equipment back into your bag and zip bag closed. Discard disposables into patient's trash. Never place back in your bag. Perform hand hygiene. If you are returning single patient use equipment to the organization, such as an infusion pump, Sharps container, walker, or cane, place in a plastic bag and transport equipment in the designated area within your vehicle. Do not place the item in your clinical bag. Perform hand hygiene. After your home visit, place your bag back on a clean surface in your car or use a barrier. Place single patient use equipment in the designated area within your vehicle. Perform hand hygiene. You should have a bin for extra supplies that has a lid to keep items secure and clean. Check expiration dates of bag and trunk supplies periodically. Limit overstocking of supplies to reduce waste. There are times when bringing your bag into the home environment is contraindicated. If the patient requires transmission-based precautions or the environment is grossly contaminated or infested, do not bring your bag into the home. Use your clinical judgment to determine if you should bring your bag inside. If you decide it's inappropriate to bring the bag inside, use a clear plastic bag to transport essential supplies into the home. Examples of these situations could include patients with transmission-based precautions, excessive clutter, unrestrained pets, or poor patient hygiene. Extreme temperatures may damage some equipment and supplies. Please note that your clinical bag should be brought indoors overnight to prevent exposure to the elements or theft. Stock supplies should not be left in the car for extended periods of time. Thank you for watching this video. Please contact your manager or infection preventionist with any questions regarding clinical bag technique.